Hello everyone, this is Dr. Qureshi. I'm a neurologist and currently working as a stroke and neurocritical care fellow here at Memorial Hermann Hospital, Texas Medical Center. Today we shall be discussing about stroke. So what is a stroke? Stroke is basically, in layman terms, we can call it as a brain attack. This occurs whenever the blood supply to the brain is interrupted, causing brain damage. Broadly speaking, it is of two types. The first type is an ischemic stroke, which accounts for about 87% and is the most common type, and the second type is an hemorrhagic stroke, which is approximately 13%. So whenever there's a blood supply to the brain, if it is interrupted by a blood clot, it will cause an ischemic stroke, and if the blood vessel in the brain ruptures, causing brain bleed, then it will lead to a hemorrhagic stroke. What you have to understand is stroke is the fifth largest cause of death here in the United States. It accounts for approximately 750,000 people getting affected annually. And globally, this is the second leading cause of death and disability. So what are the early signs of stroke? And can the stroke be easily treated? One of the easy way to remember stroke is by a mnemonic called BEFAST. B stands for sudden loss of balance or coordination. E for sudden loss of vision in one or both the eyes. F is for facial droop. A is for sudden loss of strength in an arm or leg. And S is for speech difficulty, or if you find the speech by itself sounds strange. If you or your family members ever observe either one or more than one of the previously mentioned signs, then it is high time to call emergency medical services. Now, can the stroke be easily treated? Well, what you have to understand is stroke is time sensitive. With each second passing by, about 32,000 brain cells die permanently. With the recent advancements going on, most of the strokes can be treated if they are brought well within the window period of 3 hours. Now, this window period has most recently been extended up to 4.5 hours. We can administer a clot busting medication called IVTPA to dissolve the clot, but in instances where the IVTPA by itself is unable to dissolve the clot, then we can use a catheter to go up to the brain and pull the clot out. This is called mechanical thrombectomy. So with all these advancements in our hand, it is important for all of us to be fast and know that time is brain. Thank you.